The World Health Organization and the United Nations International Children's Emergency Fund have warned of an increased risk of measles spread, with worldwide cases up nearly 80% so far in 2022, compared with 2021. The organisation said that as cities and countries relax COVID-19 pandemic restrictions, measles outbreaks become more likely. Nearly 23 million children missed out on childhood vaccinations in 2020. Childhood vaccination campaigns have been hindered recently by the COVID-19 pandemic and conflicts in Ukraine, Ethiopia, Somalia and Afghanistan. According to the WHO and UNICEF, coverage at or above 95% with 2 doses of the safe and effective measles vaccine can protect against measles. In all 5 countries with the highest cases in the last year, first dose coverage was below 70% in 2020. China's commuter workers are struggling to make ends meet as Beijing's zero-COVID policy severely restricts travel between cities and provinces.
For Chinese commuter workers on the outskirts of Beijing, waking up in the early mornings to travel miles away for work has gotten even tougher than before.
I cannot go back home. If you go back home, you'll be quarantined.
62-year-old Lao Yuan and many others like him rely on ease of travel to make a living. But China's strict zero-COVID policy has upended their lives completely. Analysts at Nomura estimate nearly 350 million people in China are currently facing some form of lockdown, and movement between cities and provinces has been severely restricted. Some workers haven't been able to go home, while others have struggled to find any work at all.
During the pandemic, there are very few jobs. It's hard to earn money. We don't earn enough, and the city police chase us away.
The pandemic situation changes quite fast. For example, yesterday Beijing was not rated as high risk, but in the morning when you wake up, the city has a star labeled next to it on the tracing app.
Towns like Yanjiao have seen explosive growth over the past decade, as hundreds of thousands of residents commuted to and from nearby Beijing on a daily basis before COVID. But now, many face difficult requirements just to earn a commuter pass, allowing them to step foot inside the city.
For the commuter pass, you'll need proof of employment, a 48-hour COVID-19 test result, proof of residency and such. Now, people are saying it's not being issued anymore.
Beijing has started stepping up entry checks and locking down some public spaces, as it announced plans to test nearly all of its 22 million residents for COVID this week.
So with COVID cases continuing in China, and as we just heard with the announcement from the World Health Organization and UNICEF that the number of measles cases are increasing around the world, I'm joined to discuss this with live from Bath in England by Dr. Bharat Pankhania. Dr. Pankhania, thank you so much for joining us today. I think I should, in welcoming you back, it's been a while since we've spoken, I should remind everyone that your field of expertise is indeed in communicable diseases. And we've been focused on one communicable disease, COVID-19, very strongly for the last 2 years. But maybe that's been at the expense of other very serious transmissible diseases and illnesses like measles. What can you tell us about the situation and the news from the WHO and UNICEF?
It's very worrying, Andy, because measles is highly infectious and it can make children extremely ill. And in some cases, they may also die. And Andy, we don't have a cure for measles. Once you've got measles, we can only give you supportive treatment. So the one cure that we have, in inverted commas, is to be fully immunized. And also one more thing, the vaccine is very safe, it works very well, and this outbreaks are an indication of something is not right in many parts of the world.
So it's the same basic message that you've been telling us for the last year with regards to COVID-19, vaccination, preparation, prevention. Now, obviously, measles is something which is preventable, and vaccines have been available for a very long time. So why is it that in various parts of the world, and I guess there are different reasons, why is it that the vaccination levels have dropped off recently?
A lot of it is to do with low-income countries and breakdown of healthcare systems. So if we look at the countries where we've got the larger outbreaks, Somalia, Afghanistan, Ethiopia, Yemen, these are all countries where they've got problems. And with these problems, the vaccines take a lower priority. And actually, outbreaks of these measles is also telling us that there are other infectious diseases for which we may also get outbreaks because their vaccination program is faltering.
And that's something that we mustn't be complacent about, of course, because in the West we're with our very generally proficient healthcare systems, we're a little bit complacent about illnesses popping up in different places. Polio, for example, being widely eradicated across Western nations. Is there a risk that coming behind this measles outbreak, that other diseases that we thought have gone away might be resurging as well?
Oh, without a doubt, Andy, because as I said, the failure of the measles vaccination is also indicative that we are failing on other immunization programs like diphtheria, whooping cough, meningitis, and all of these are vaccine preventable. And unfortunately, when we've got these outbreaks in low-income countries, they also become our problems. So, for example, we've had outbreaks in the United States and the United Kingdom, and both of these outbreaks are travel-related. People go to one part of the world, get exposed, and then bring it home to United States, United Kingdom, European Union, and create outbreaks if the population is not fully protected and immunized. And for diseases, infections like measles, which are very, very, very infectious, it has an R0 of over 18. In other words, one case can make 18 new cases if they are not protected.
Context, I mean, the R number for laymen like myself and for most of our viewers, I'm sure, is something that we've only heard previously in the context of COVID, and anything above 1, so 2 sounded like something pretty dramatic. But you're saying 18 for measles. This is quite shocking.
It is. So measles is one of the most infectious diseases that we know of. And in fact, if you have a room full of susceptible people and you're there with one infectious case, after an hour or so, all those susceptible people will get exposed and infected. It's very infectious. And that's why we need 95% and above vaccine coverage to prevent these outbreaks.
One of the other buzzwords that was going around in the last year was vaccine equality, and I'm sure tied with that is as well healthcare equality. The World Health Organization and UNICEF, of course, are doing a tremendous job under very difficult circumstances. What sort of support do they need from the nations that are behind them?
So what we need is not only a supply of vaccines, which is readily available, good job too, but we also need logistics support. And finally, one more very, very important thing is protection, security protection. So as we both know, people who were trying to eradicate polio in distant parts of Pakistan and India, they were killed. So we need these people who are doing a great job protecting a large population from an infectious disease to also be supported, protected, enabled. And then one more thing that also needs to be done is inform, educate, and advise the population that these vaccines are safe, they protect you from a very serious illness. And the good job is vaccines are readily available.
Well, that of course is both the good news, but also to our shame that we're not doing everything we can to make sure that they're delivered into the communities where they're so badly needed. And also to our shame that there are other communities that are rejecting, particularly in certain educated parts of the world, that are rejecting the opportunity to have the vaccine. With that other buzzword, it's a day of buzzwords, vaccine hesitancy. Is this playing into the problem as well?
Not so much, but because the countries where the outbreaks are occurring are more low-income countries where there is war and insurrection. However, unfortunately, in highly developed countries, rich nations, United Kingdom, European Union, United States, there is, unfortunately, in some places, vaccine hesitancy. And I say to all these people, please remember, measles is misery. It makes your child extremely ill, extremely unwell, and not only that, but they can remain unwell and out of sorts for up to a year and expose themselves to further infections because it lowers your immune resilience. So it is a serious infection, and unfortunately we had in the early 1990s a wrong paper published by The Lancet, written by Andrew Wakefield, which tried to make links between autism and measles vaccine. That was extremely unfortunate, and the legacy from that time still lingers on in some parts of the world.
And that comes back to your point again about education, that educating all communities, whether they're from a rich nation or a poor nation, that education is just so important to get the message out there. Let's just, we've just got a minute or so left. Let's just wrap up by bringing this what is new information to us, of course, to the medical community. The rise in cases of measles is something which I'm sure you've been aware of for a while. But how does this tie in with the emergence from the pandemic? And what should everybody continue to be doing at this? But I imagine is a stage where there's a lot of excitement, summer's coming, that COVID seems to be behind us. But as somebody pointed out yesterday, endemic doesn't come from the word end. It's not the end of of COVID. What do we still need to be doing to protect ourselves, not only from measles and these other horrible illnesses you've mentioned, but also from COVID, which we've become so familiar with?
So what we should do is not drop our guard, and we need to just have a look and review, because in the last 2 years, people have been, what we would say, out of circulation. So they may have forgotten that their child needs their essential vaccines: measles, mumps, rubella, diphtheria, whooping cough, meningitis, tetanus, etc. So a well-protected, well-immunized child has got a much, much, much better chance in life. And of course, for governments and public health authorities, vaccines protect, and they protect at a cheap rate. It's much cheaper to immunize than to deal with children or adults who are ill with a serious infection in hospitals. So it is an extremely good value for money thing to do, and it is going to do you good long-term in life. It holds you better if you are better protected from these nasty infections. One more thing, Andy, is I am concerned about the war in Europe. So we expect problems from Ukraine and the conflict in that part of the world. We need to not take our eye off the ball that whilst there's a war going on, we need to also maintain as much as we can our immunization program.
And this is something which is so important. The message you've given us is one that, in theory, is so very simple to follow through. And yet we find excuses for not doing it. But the time for excuses has finished. Dr. Bharat Pankhania, thank you so much for joining us today. It's a pleasure speaking with you again. Thank you.
My pleasure. Thank you.